Okay, I walk into the room with my patient, initially check the order, and then identify my patient. Hello, sir. Can you tell me your name and your date of birth, please?
And Charles Ross, October 1st, 1991.
Then I would check his ID band against what he had said. I would show the patient has a private room. Alright, for instructional purposes only, I'm going to be stating all of the areas for subcutaneous and IM injections. To my patient, I would say, alright, today, sir, we're going to be giving you 2 shots. One probably in front of your thigh and one here. But I'm going to say all of the places where you can insert a subcutaneous or IM injection. First place for subcutaneous injections would be in the abdominal area, 2 inches away from the umbilicus. You could also use the lateral side of the abdominal area, the top of the back here, the back of the arm here, or the front of the thigh. For intramuscular injections, you can do the deltoid, and you find the deltoid by placing your hand here. And this is where you would inject. Can you stand up, sir? For the vastus lateralis, you take the seam here and here, and you separate the area. This is the area for the vastus lateralis. The ventrogluteal and the dorsogluteal you find by first locating the trochanter, which is easier if they lift their leg, please, sir. You can see the trochanters here. That's good, thank you. And then you move up until you find the top of the iliac crest. And then on the side, this would be your ventrogluteal. And you do the same thing. I already know where the trochanter is. Find the top of the iliac crest. And this would be dorsogluteal. Alright, you may sit down. When to administer the medication, I would first take the vial and select my needles. Since I'm going to be doing an intramuscular medication first, I'm going to select this needle. You can select anywhere from a 20 to 23 gauge. Since I'm going to be using this part, if I was using the deltoid, it would be 25 to 27 gauge. The length of the needle is going to be 1 to 1.5 inch. First I would open this. First I would apply gloves, after having done my hand hygiene before ever touching the patient. Opening this. Now since this was the first time it was opened, I wouldn't have to do an alcohol swab, but had this already been opened, I would alcohol swab it, and I would mark the date and time that I reused it or opened it. For 1 millimeter, I would probably choose a 3 millimeter sliver hinge. I would attach the needle, press it down to take the cap off. Alright, I would draw back 1 millimeter of air and insert that without breaking my needle into the insert 1 millimeter of air, turn it upside down, and withdraw 1 millimeter of liquid. And I would hold it at eye level just to make sure I had the right amount of liquid. Afterwards, pull back, tap away any bubbles. Alright, for the site, first I would clean the site. Since it's an intramuscular injection, I would spread it taut, and with a quick darting motion, I would go in completely. Now, I'm not going to do this, but I would slowly inject and then quickly withdraw, applying pressure immediately after, while using alcohol pad. And if there was bleeding or if it was necessary, I would apply a bandage. And then I would dispose of the needle in the sharps container. And I would not recap it. I'm about to do. Alright, for the subcutaneous injection, 1 millimeter, I might use this one. I might still use this, but I would use a different length of needle. I would use a 25 to 27 gauge needle, and it would be 1/2 to 5/8 of an inch long. I would attach it here. I'd press it against the table, release it. There's this short needle. And the same thing, if I was to inject it and withdraw. For this one, I'm not, according to the instructions, actually withdrawing, but I would inject the same way. A quick darting motion after pitching up and cleaning. I would pinch it up, do a quick darting motion into the fat. With the pad, it doesn't really work. And then After I had edited in, I would unpinch it, slowly inject, quickly withdraw, apply pressure immediately afterwards, and a bandage as necessary. And I would not recap the needle. I would dispose of it in the sharps container.